going to do is talk a little bit about what focus groups are and how they can be used, and some practical guidelines to follow in using this tool. And the beauty of focus groups is that there really aren't any hard and fast rules, but just a set of tactics and techniques to serve as guidelines while still allowing you as a facilitator some flexibility. I love doing focus groups. I've done them in different capacities in the past. In a previous job, I worked in the pharmaceutical industry, and we used focus groups to talk to managed care executives to learn more about pharmaceutical product placement in their formularies. I've also done this training for public health colleagues for planning purposes, such as the Healthy New Jersey 2020 effort for pandemic flu planning several years ago. We've also done this with the public in pre-testing some of our educational materials and programs. And as Linda had mentioned, with the anthrax situation where the postal workers were exposed to the biological weapon, we did some focus groups with them to learn more about how we could provide better information for them during that situation. I've also taught public health professionals how to do focus groups and how to plan them and how they can conduct these in their communities. And I also provided some technical assistance to Hudson County on their Zika focus groups, which you'll hear a little bit more about later in this program. But they really are a great tool. I like to use them whenever possible to enhance my work. Today we're going to cover the 6 Ps of focus group planning. We have purpose, protocol, participants, place, presider, and prompts. And we'll talk a little bit about each of these more in depth. Next slide. First, we'll go over the purpose and learn more about what focus groups are and what types of work they're used for. A focus group is basically, back one, the 2. That's it, thank you. Okay. A focus group is basically a form of qualitative research that is based on talking with group and interacting with group members, and it's a great way to engage your target audience in the planning of a program as a type of formative evaluation. This is an opportunity to have a rich dialogue with a subset of your target audience, to spend time listening to them, gathering information, understanding how they think or feel about a situation, or a proposed program, or some new educational tools that you're unveiling, and to gather their reactions and opinions. It's important to remember that a focus group is not just a verbal survey tool. So focus groups should not be delivered as if they are a survey. They are a prompt to have
just a few, not a lot.
A conversation. Oh, sorry, I just heard somebody talking. This is an opportunity to have a dialogue with a subset of your target audience, to spend time listening to them, gathering information, understanding how they think or feel about a situation or a proposed program. I'm sorry, I'm lost my track. Focus groups are different than surveys. We don't want to ask a lot of yes and no questions. These are opportunities to talk about open-ended things so that you can have a more in-depth dialogue with them. So always be thinking about how your focus group can provide better information than a survey would obtain. And focus groups are an opportunity for us as program planners to listen and gather information and to understand how people really feel about an issue and to gather their opinions and things that would factor or influence their behavior. Next slide. Thank you. Focus groups can be used as the primary source of data in your study, or they can be used to supplement and explain findings from other existing data sets. Perhaps you have a data set from a survey that showed some trends in responses, or perhaps some surprising findings. You could develop a focus group discussion to further explore those issues or learn more about what factors were behind those findings. And they can be combined with other data gathering methods, such as key informant interviews and literature searches, to give you an opportunity to explore a topic in more depth. Next slide. Focus groups are great for helping us to understand differences in perspectives, uncover influential factors in a topic, and to hear a range of ideas. With regard to quantitative studies, after hearing feedback in focus groups, the discussion may be able to be used in designing a follow-up quantitative study, such as a survey, Or flip that around and perhaps you have a set of survey data. You can then do focus groups to dive into particular survey results where you may want more information about why certain things surface during your survey. Focus groups are also good for learning the lingo of a particular audience, which can be helpful in your message development that would grab the intended audience's attention. In public health, focus groups are especially helpful to us in different phases of a project, including the formative assessment work that we do at the outset of a program, such as decision-making, pilot testing, and then again at the back end of the project for use as a potential evaluation strategy. They help us gain understanding through the eyes of the audience to learn about their point of reference and to help us to be sure that what we are developing or planning is relevant to them as a target population. So to give you all a real-life example, I was tasked with creating an educational video for prison inmates about preventing methicillin-resistant Staphylococcus aureus skin infections, or MRSA skin infections for short. I had never done a project on MRSA before, and I had never created something for prison inmates as an audience before, so I needed to learn more not only about the topic itself, but what information the inmates wanted or needed in order to take action, and also what barriers or restrictions they had with carrying out recommended behaviors, being that they were in prison. I had no idea if what I was going to tell them as recommendations would feasibly be able to be done. And I also wanted to learn more about prison culture to be sure that we weren't going to turn them off and cause them to dismiss our message by just not being relevant or relatable to them. So the inmates were incredible resources. We did multiple groups, both in men and women's facilities, and they gave me so much information to put together the program that I needed to do. And their involvement ensured that the information and the visuals were relevant to the prison population. Next slide. So we're going to talk a little bit about the strengths of focus groups, and they have many strengths. One of the best things about focus groups is that they are efficient, meaning that you can have a lot of interaction in a limited time frame. You have the ability to ask questions about their responses directly. So if they tell you something, you can go more into depth, whereas with a survey, you just basically get an answer without understanding why. You also have the ability to share and compare, meaning both researchers and participants can learn something from the group discussion. Group dynamics can be a positive as people begin to talk and recall events about the topic. It can stimulate the memory of the other participants and enriches the discussion. The people can build and elaborate on each other's stories, and it ends up being a more interesting way than surveys to gather information. And also the focus groups provide a human connection, which I think is a real important aspect of this. As opposed to a survey result, which is completely devoid of any direct communication where we only see numbers or check boxes for responses, with focus groups we have people, and we have their thoughts and their feelings attached to the results. And likewise for the participants, they also establish a connection with a public agency and people who work there. This aspect is very evident when we did the focus groups for the postal workers who were exposed to anthrax in 2001. By the time we came in to do the focus groups, they were feeling pretty much like test subjects. They were being given medication. You know, they really weren't part of the process. They were just being told what to do. So they didn't feel like people. They just felt more like subjects in a big experiment. They were very frightened, and they were not adhering to their recommended preventive antibiotics. So the focus groups gave us an opportunity to establish a human connection with them and to learn more about the gaps in their knowledge that were preventing them from taking their antibiotics. Next slide. Okay, so whereas focus groups can be wonderful and give us a lot of information, they also have some weaknesses, much like other things. For example, these are basically forced social situations and may be uncomfortable to some people who are being asked to share opinions in front of others. This could lead to discussions that are difficult to manage. People may not be forthcoming or may feel intimidated about divulging information that might be perceived as controversial or personal or sensitive. For some people, self-disclosure comes very easily, and for others, it's quite difficult. So you never quite know exactly what you're going to get. Once again, we see group dynamics here, whereas it's a positive, group dynamics can also be a negative. A group can have really good chemistry or really bad chemistry, and there's really no way to know which way that group will go until you get there. So that's always something to be aware of. Anytime there's self-reporting involved, the information you get can be colored by many factors, such as the ability of people to accurately recall situations. And once again, with this being self-report, many people may not share everything that they're thinking due to the public nature of the discussion. They may not want to be perceived as having a very different opinion than the rest of the group. Individual interviews allow you to spend more time with individuals, but the focus group is a trade-off. Similar discussion, but less time with each person individually. An unintended weakness is that there's the potential a facilitator may lead the responses from the participants. Sometimes it's hard as a facilitator to not jump in and provide some facts about whatever the topic of discussion is. But this really becomes a matter of training and discipline on the part of the facilitator. So you don't want to use the focus group as an educational opportunity. And unlike a survey where each answer is tallied, depending on your group, the people may be very vocal about issues that the majority of people might not be experiencing. For example, from the Superstorm Sandy Health and Wellbeing Assessment Survey several years ago, one of the questions asked if the person had had a loss of income due to the storm, either temporarily or permanently. This may be the minority of people who had this experience compared to others who had more common experiences such as property damage and loss of power, etc. But the makeup of a particular focus group could potentially bring out the loss of wages as a dominating issue when really, in reality, based on findings from a survey, the loss of wages applied to less people than some of the other concerns did. Next. So the next P we'll talk about is protocol. And the protocol is basically a short plan of action that lays out exactly what will occur for the focus group. The three major pieces of information are the introductions, the agreements or ground rules, and the prompts, which is your discussion guide. Next slide. Here's a brief introduction. The moderator and assistant moderator introduce themselves. The participants introduce themselves, a brief explanation of the purpose of the focus group and topic, explain how folks were selected to participate and how the group will function by responding to questions that the moderator will ask. Review your agreements, such as everyone should listen and be courteous and speak only one at a time, which is especially important if you're going to be audio recording. Encourage full participation from everyone. And if you will be recording, be sure to let everybody know and let them know about any other logistics they should know about in terms of the building. And we'll talk a little bit more about the discussion guide a little bit later on in this talk. Next. Okay, so next we're going to talk about who you're going to have sitting in the room with you. Large corporations that have ample monetary resources to put behind recruiting participants for focus groups do not face the same challenges in the public sector for recruitment. One of the first considerations regarding your participants is the size of your group. Typically 5 to 10 people is ideal. Groups larger than 10 are more difficult to manage and also limits each person's ability to contribute their thoughts. Yet too few people may limit the range of experiences that are shared during the group. It also helps to consider some other factors when determining how many people you want to have in your group, such as the purpose. So if your purpose is to develop an understanding of an issue or behavior, invite fewer people. If the purpose is to pilot test an idea or materials, invite more people to get a broader range of responses. The complexity of your topic is also a consideration, because the more complex the topic, it may take more time to work through those issues, so you want to invite fewer people. Also, some topics, as we know, are they have more potential for inviting drama or passion from a group, depending on what the topic is. So typically, the more passion involved in a topic include less people. And also the number of questions. If you have a really lengthy discussion guide, you want to invite fewer people so that you can be sure to move through it efficiently. Basically there's some judgment calls that you need to make in terms of determining the ideal number of people that you want to have in your group. Next slide. And the number of groups that you want to have, generally 3 to 5 groups for public sector work such as public health are great. The number of groups to assemble is variable depending on your project needs. For example, corporations that conduct consumer research on their products have the resources to conduct large numbers of groups, often in many different geographic locations across the country, whereas public health agencies were a little more limited in both time and resources, so fewer groups are generally fine for our program planning needs. Next slide. In general, you want your group to share some experience or a relevant trait that will enable them to participate in the discussion. For example, in getting input on the development of an educational material for pregnant women, you probably don't want your group to be just women. Younger women may be actively trying to avoid pregnancy, and older women are past that stage in their life. So it would make sense that your group share the relevant trait of either being pregnant or perhaps being a new mother in order to accurately capture the information that you're looking for. And while you want them to have some commonalities, you also need enough variation to allow for contrasting opinions. It's good to avoid getting a group of people that know each other fairly well, acquaintances, coworkers, members of a particular organization. They may all have shared thoughts, perceptions, or assumptions on a topic. So it's a good idea to explore issues of education in a school district, among the executive board of one school's PTA? Probably not. Would it be better to have a cross-section of parents from several different schools? That would probably make more sense. You also need to consider your community in deciding on how gender, age, culture, married couples, or other factors will affect the outcomes. For example, do women experience a certain situation differently than men? Married couples may have a dominant partner and the other may remain silent, which doesn't necessarily mean they don't have different thoughts. They just may defer to their spouse to speak for them. Think through how these factors will influence sharing within your group before deciding on your attendees. Next slide. So there are different ways that you can recruit people who would be a good fit for your group. You can use pre-existing lists. Perhaps you have a database of people in the community who attended your educational programs and you're looking for a group to learn more about how well your agency is meeting the needs of its community. This is a fast and economical way to identify participants. You can have nominations or recommendations. You can ask neutral parties for names like local merchants or clergy members, elected officials, local residents, but all participants should not come from the same source. You may want to schedule in conjunction with another event that's already happening. If people are already at another event, you can schedule some time for them to step away during a break or a meal period to participate in your focus group. You can scout out people at a target-rich environment, such as another event where people in your target demographics will be. If you're looking to pre-test materials designed for pregnant women, you may want to recruit from childbirth classes, for example. And then there is the snowball sample, which occurs when you have a participant and they recommend someone else who recommends someone else, and so on. And depending on your budget, the last 3 examples may be out of reach for some agencies due to cost or staff time constraints, but they are options. So that would be your screening selection services, random telephone screening, or placing ads or announcements in newspapers or on websites. But once again, they cost money, and that's always something that needs to be factored into your program. Next, we're going to talk about place. Next. So here are a few considerations for selecting a location for your meeting. Hold your focus group in a neutral, comfortable setting. If you have a table, it's always a good idea to arrange the participants so they can all see each other, such as in a U shape. Or if you're just using chairs, it's great to place them in a circle with an opening where you can stand between the opening and the chairs. It's great to be able to audio record the discussion if possible, so that you can have accurate transcripts created or have a way to fill in your notes. If you'll be recording, make sure that the setup is conducive to that. If you have the funds, I highly recommend using a focus group facility that will have professional audio recording and transcription as available services. It makes life a lot easier if you can afford it. We recently did a project of physicians in a real focus group facility, and it worked out really well. And the facility even did the recruitment of the physicians for us. So that was a real benefit also. Also, just a general housekeeping issue, but an important one, make sure there are bathrooms nearby to your room. It's a good idea to do a bathroom break before you begin, so let everyone know that you're going to be in the room for about an hour or so beforehand so that they can make use of the restroom facilities and not have to interrupt the flow of your focus group discussion. If you expect your group to run longer than an hour, schedule a bathroom break into the time frame and let them know ahead of time when that break will be. Next. Okay, the pre-session strategy. Make sure you get there early to set up before the participants arrive, and this will allow you to troubleshoot any issues that may arise. Once the participants arrive, your job as the host begins. Be sure to create a friendly, welcoming atmosphere and greet the participants as they arrive at the door. It's a good idea to make small talk with the group before it gets started in order to get a feel for their personalities. Don't talk about the focus group, just make some chit chat about other topics because you don't want to influence their discussion during the group. Next slide. If you plan to provide refreshments, be sure to provide quiet food, meaning no crinkly bags of chips or crunchy foods, and use quiet servingware that won't make any noise. Plastic water bottles make a lot of noise when being handled, and all of these sounds can become very distracting to the conversation and can especially be a problem if you're making an audio recording of the session. On the last slide, I mentioned talking to the participants to get a feel for their personalities. Some moderators prefer to use strategic seating to help address issues with shy group members and the more outgoing, talkative ones. Next slide. So this slide shows you a potential seating strategy and how you can maximize the people that you have. So, for example, you may want to seat the folks that you perceive to be more shy directly across from you while keeping the dominant people closer to your side. And this can be helpful in two ways. First, you'll have more direct eye contact with the shy people who are across from you, which can help draw them into the discussion. And if you have the more dominant folks closer to you on your sides, you can actually use your body to control the conversation. So, for example, if someone is dominating the conversation, by keeping them close to you, you can step further into the seating arrangement so that they are now a bit behind you until the quieter people have had a chance to speak. And then you can, back up again and make eye contact with the rest of the group. And this is why the U-shaped table setup or, a semicircular chair arrangement works well, so that you as the moderator can actually step into the center to control the conversation. Next slide. A few other considerations regarding the place. Be sure to choose a location with adequate parking. Make the group as stress-free as possible with good signage to direct the people to where they need to go. And depending on your group, you may want to arrange for transportation or childcare services to make it easier for people to attend and enhance your recruitment efforts. Okay, preparing for the unexpected. So try to think through various situations and have a backup plan. Some of the problems that may be encountered are that no one shows up or fewer than expected show up. Decide within your agency how you will want to handle that. How will you handle it if people bring their children or another guest with them who was uninvited and may not be part of your target audience? How do you get folks to leave at the end? They may be having such a great time that they don't want to leave, and I'm sure that many of you as community health educators have experienced this. People like to stay and chat for a while afterwards, especially if they're having a good time. The next slide is about the presider, who is also the moderator. Next slide. So basically, the moderator has two basic roles to fill. The voice at the table and the person who leads the discussion using the discussion guide. Your assistant moderator is the support person in the room. So the role of the moderator, next slide, okay, is to ask the group the questions and to actively listen to the responses so that you can follow up with the thoughts that are raised. The moderator also moves through the discussion guide and keeps the conversation from veering off track, which can be very challenging at times. It's also the role of the moderator to keep track of who has spoken or has not spoken and to make sure that everyone feels welcome to share. Next slide. A good moderator realizes that the focus group is not just a job or task that needs to get done, but rather it's a great opportunity to better understand a group of individuals. The moderator is not always someone in a leadership position within your organization or the most senior person working on the task. It should be the person who has the best set of skills to make the most of this opportunity. Someone such as having strong communication skills, someone who's open, somebody who doesn't become defensive or flustered easily, and someone who can relate to the group in such a way to make the people comfortable and get the most useful information from them while they're there. Next. And the role of the assistant moderator, this person is usually the official note taker, especially if you don't have recording equipment. You really need very good notes. It's great to be able to have someone that can take notes in detail. So, for example, when I'm moderating, I'll often take some notes on a flip chart, more so for the benefit of the participants as a visual cue and to help them keep track of the discussion. But the detailed notes that help drive your program planning come from the assistant moderator. So trying to capture too much information on the flip chart can actually slow down your discussion and cause delays as the participants wait for you to finish writing, and they may not complete their thoughts or may not roll as easily into another thought. And it's just not as possible to capture as much information on a flip chart as you can do with a notebook and a pen and paper. The assistant moderator can also help deal with unexpected interruptions, although it's great to have even a third person available that can serve as a runner or to help deflect these disruptions that happen to make sure that the assistant moderator doesn't get pulled away from the note-taking duties. And the assistant moderator can also help handle logistics regarding location and room setup and signing in the participants and helping with name badges and things like that. Next slide. So moving on, we'll talk about some helpful hints for the moderator, and I have several slides full of these tips. It's important for the moderator to become familiarized and comfortable with the questions. Practice your introduction and the line of questioning to be sure that it has a logical, natural flow to it before you go and actually do the focus group. Try to get an idea of how much time to spend on each question, which may be difficult to do based on the amount of conversation generated by the participants, but at least try to figure out which items are of greatest priority or what your key questions will be. Next. Become familiar enough with the questions so that you don't need to read them from the paper. If you're reading from the paper, often you'll lose eye contact and connection to the audience. Be alert so that you can properly drive the conversation and pick up on themes that may be developing in the responses. You may find that you need to throw in an impromptu question that's not been anticipated when developing the discussion guide, but based on the way the conversation's going, you may want to explore some of those responses a bit more deeply. You also want to remain alert to be sure that the folks are actually answering the question and staying on track. Next. Feel free to ask people for clarifications as needed. Remember, that's one of the positive things about running a focus group is that you can have instant clarification and you can ask them questions about what they mean by their responses. You want to keep your actual involvement in the discussion to a minimum, which can be very challenging. And as I said earlier, it takes some experience to learn how to control this. We as educators are so accustomed to actively engaging with discussions and people, and it's tough to basically be a part of a one-sided conversation. It's actually quite awkward sometimes. So try to keep your verbal reactions and your body language in check and keep it all very neutral. For example, having a nod of your head every now and then, if done slowly, can be a sign that you are listening. But if you nod your head too quickly, it can be interpreted as a sign that you're in agreement with them, and therefore you might unintentionally bias the discussion by encouraging them to say more things like what you just heard and you seem to be agreeing with. As for verbal interactions, saying things like okay or I see can acknowledge a person's response and show that you're listening. But what you don't want to do is say things like excellent or good point, things like that, which can give the impression that these are the right answers that you're looking for. And once again, this could influence the way that your participants are responding to your questions. And we just really want to be careful that we're not leading the discussion in any one particular direction. We want to make sure that the participants are deciding what needs to be brought to the forefront. Next. And once again, relating to being alert is being prepared to improvise, to throw in some probes and pauses if needed to draw out additional information or clarity. Also have a backup strategy. If conversation is stalling or you have some quiet folks in the group, you may need to have another way to draw information out. Also, be prepared for repetition. Often the same information will continue to be brought forward. This isn't always a bad thing and can actually validate some thoughts you may have had about a particular topic. Next. And finally, you may choose to follow up by phone to thank the participants. This is not only a nice way to end the project, but it offers the participants one last opportunity to give any thoughts, perhaps something that they may not have felt comfortable with during the larger group, or maybe an afterthought they might have had. Next slide. So now we'll move on to the next P, which is for prompts. So before writing your discussion guide, it's important to have very clear goals and objectives. The sample objective above falls short. And those of you who are in health education should be able to spot the reason why. So if you had somebody that said their sample objective is to promote New Jersey 211 calling service to the participants, we have to remember that we're not promoting things during a focus group. A suggested rewrite to that would be to identify the community resources participants have used in their recovery efforts. And you want to listen and see if they mention New Jersey 211 as one of the resources that they've used. Okay, so the next sample objective is to promote New Jersey's community resources to those recovering from Superstorm Sandy. Once again, we're not promoting anything, but something you may want to suggest as a rewrite would be to identify the best channels for raising awareness of New Jersey's community resources and to see what the community generates as examples. Okay. At the beginning of the discussion guide, you want to start with a warm-up question that gets the participants thinking about the topic. Keep it very general, very light, nothing uncomfortable. This should just be your softball question. The first few minutes of discussion should be used to get people talking and getting more comfortable with each other as a group and to help loosen them up so that they can start providing, more comfortably the information on some of the questions that may be more difficult for them. And then the following questions can begin to dig deeper and become more pointed and more detailed as you delve into more specific questions. Next slide. So then we also have 3 Ps of focus group questions. We have the prompt, the probe, and the pause. Your prompts are basically a set of open-ended questions to guide your discussion. Remember, you want to try to avoid yes/no questions because that does not lead to discussion, but if you have them open-ended, it will be much better, much more fruitful. Try to have no more than 12 questions so that you'll have time to get to all of them. But of course, the amount is flexible depending on the length of your session that you've planned. Include 3 types of prompts. You have your opening question, which is your easy warm-up question that we talked about on the previous slide, and something that has a positive feel to it. You don't want to dig into anything controversial or emotional right away. So, for example, if you're talking to people about their experience with hurricane recovery efforts, you may want to say, the storm recovery has been a long road. What have been some of the things that went well in the recovery efforts so far? This is a good warm-up question, even though your primary purpose is to learn about what is not going well with recovery efforts. Then you have your key questions that address the topic at hand, and lastly, a concluding question that help wrap things up and sum up the discussion from the session. So have the questions arranged in a naturally flowing sequence. Ask the broad general question, which is your prompt, and then you can drill down to more specifics, as we saw earlier on the pyramid slide, which are your probes, where you get more information from people. And we'll talk more about probes in a minute. Make sure you don't get lost in your discussion, and don't lose track of time, because you'll find that the time flies by very quickly when you start talking with people. Next slide. So in terms of questioning, when you develop your questions, as I said before, use open-ended questions. The yes/no answers or one-word answers don't lend themselves to discussion. So when introducing new questions, use phrases such as "think back to a time when," to set the stage and to get them thinking. If you need clarification, try to avoid asking why, and instead use questions such as "why did you feel this way?" or "what prompted this?" And as difficult as it can be to try to avoid giving examples, you really should not give examples, because ideally you want the group to be telling you this information. So build alternative ways to ask a question in your discussion guide as a fallback in the event that the group is just staring at you blankly because they either don't understand the question or it's not in a relatable manner. So if you have the question written several different ways, that can be helpful for drawing information out of people. Next slide. Okay, so the first question you see here, a sample question, have you heard of NJ211? So what we've heard so far tells us that that's not a good question, because that would be a yes or a no. A suggested rewrite to that would be, well, what are the community recovery resources you've used since the storm? And you would once again see if NJ211 came out of that discussion. So it's, basically, as we said, a yes/no question is not ideal for this setting, and it's limiting because it will only yield information about whether they've heard of NJ211, but we would like to know about other resources that they're utilizing. If we're the people that want to promote 211, we want to know who our competitors are and what are they doing better than we are to get their information out to people. Try to ask positive questions first before moving on to the negative questions, which may be more difficult to discuss. Give participants an opportunity to respond to both positive and negative questions, and try not to rephrase the question automatically. Only do that if absolutely necessary, and try to stick to the ones you developed on the discussion guide. Also, be sure to only ask what you really want to know. Don't have a lot of extraneous information in there. And make sure that all of your questions have a reason and that they relate back to your overall objectives of holding the focus groups. Next slide. Okay, and our probes, they're basically a way to drill down and get more specific feedback, such as when an answer is a bit vague, you can ask additional questions such as those here on this slide. Could you please explain further? Would you give me an example of what you mean? Can you please expand on that comment? Things like that. For example, a participant may say, I called New Jersey 211 and it wasn't a good experience. So the moderator would ask for clarification. Can you please explain further? What did you find in that experience that wasn't a positive for you? And then you may hear something from the participant such as, well, when I called, the operator was unfriendly and didn't seem to be prepared to answer the questions I had about the difficulties I'm having with my home after the storm. Next. And finally, the moderator can ask a point of contention probe that can help uncover opposing positions. So if you hear that everybody has been in agreement on a topic so far, you can ask and, just quite frankly, just say, does anyone see this differently, or has somebody had a different experience with this, to try to draw out some other opinions than what surfaced. Okay, next, now the pause. People tend to be very uncomfortable with a pause. However, if you stand there for a few seconds of silence after a conversation has stopped, one of two things will happen. Either conversation will start again because people tend to want to fill that quiet void, or the conversation really has just been thoroughly exhausted and you're done. So this is a way that you can find out if there's more to come forward or if you're really done exploring that particular question. And it's a good idea to use that pause with a lot of eye contact. So kind of go around the room and, invite people in with your eyes to make another comment. Next slide. And you always want to try to anticipate the flow of discussion during your preparation. Try to think through the various directions the conversation could go, and have some redirects planned so that you can bring the group back to the areas that you want to explore. And if time permits, you can always pilot test your focus group, but that's often unrealistic in the public health world, I think. We're lucky enough to have time to plan and prepare for delivering our focus group as it is, much less to pre-test our focus group. Next slide. It's probably unavoidable that someone will ask a question at some point during the focus group, and since we don't want to be providing information to the group during the discussion, you need to have a way to handle questions that arise during the discussion. You could do several things. If it's something that's likely to be known by someone in the group, you can ask the group to answer the question. This can also be a way for you to hear what the knowledge of the topic is among your group. It's just another way to, get more information from them, and you can see what kinds of misinformation they may be carrying with them as well. You can also postpone the answer if it's something that will potentially lead the discussion in one direction or another. Simply write it on a flip chart and explain that you'll answer it at the end of your discussion. Or if you're sure that the answer would not bias your conversation, you can answer the question directly. But once again, if there are any questions that you can reasonably anticipate, have a plan on how you will handle them. Next slide. Okay, so for analyzing your focus group, after it's complete, you want to take a look at what you've gathered and determine what you've actually learned from it. So some folks may have access to qualitative analysis software, but my experience has always been to review transcripts or notes and then draft an analysis manually. The analysis should only be done by someone who was present in the room and should only focus on the most relevant conversations. Be very careful about your personal bias and to not let it interfere with what you choose to report on. Remember that you're the spokesperson for the participants and you should provide the feedback accurately the way they presented it to you. While you can look to the information for frequency of responses, don't try to use numbers in your report. It's really not a quantitative study and it shouldn't be presented that way. Focus more on capturing the major themes of discussion that were presented. Next slide. And lastly, just a few words about reporting your findings. You want to be very succinct in your report. Depending on the length of your conversation, your transcript can be very lengthy, or your notes can, be many, many pages. So be succinct, know the key points, and choose what's most valuable to your group to know and to get it quickly with clear, effective writing. When you're putting the report together, it helps to punctuate certain concepts by including direct quotes from the participants, or perhaps audio clips can be inserted if, or maybe visuals from the group. If you had the group chart something out or try to draw something to explain a certain concept, you may want to capture pictures of those to include into your report at the end. So that's it for my presentation. Linda, I don't know how you want to do this, if you want to do questions all at the end or take the questions for me like right now.
I think if it works for you, Suzanne, I'm going to encourage questions at the end, but I would for the participants that are on, if you didn't hear the intro, there is a chat feature that's available at the bottom of your Zoom bar. Feel free to put any questions you might have for Suzanne in there, and we will do our best to get to them at the end.
Okay.
I am just realizing that I was muted there. I'm sorry about that. We're going to move on to Monique. Monique Davis is the health educator, health communicator for the Hudson Regional Health Commission and the Hudson County Links team since January of 2003. She graduated from the Rutgers Graduate Program in Public Health in 1989, provided health education in a variety of settings throughout her career. Her role at the Hudson Regional Health Commission has included delivering health education programs for community members, health professionals, students, and business persons on a variety of public health emergency preparedness topics. These include H1N1, Ebola, flu, and Zika. She's also a public health planner for Hudson Regional Health Commission and plans to and conducts exercises with local partners on public health responses for various efforts. Mosquitoes also love Monique, so she's not planning to travel to any Zika-affected communities anytime soon. So, Monique, I'm going to ask you to take it away. Monique, we can't hear you. I see that you're talking, but we can't hear you.
All right, let's try that. Can you hear me now?
We got you now. You're all set to go.
Sorry, I unmuted the screen, but not the phone handset itself. So thank you, everyone, for joining us today. And thank you, Suzanne, for a fantastic primer on what a focus group is and how we can use this as a tool as we're informing our planning projects. So what I'd like to do today is to share a little bit about our experience and how we used it during Zika about 1.5 years ago. So thank you to Suzanne and Krista for all of your guidance and assistance as we plan the program and implemented and have evaluated the program. So I want to start out by talking about really the genesis of this Zika focus group. Why did we choose to use a focus group during the Zika experience not too long ago? We were told by the regional epidemiologist from the State Department of Health that Hudson County was submitting the most number of test specimens for Zika virus testing throughout the state. That was a little bit alarming for us because we felt that we had blanketed the county with information, and not only in English as the primary language, but also in Spanish. So we thought we were doing a fairly decent job of getting the information out that was relevant. And we used multiple platforms as well. So that was pretty alarming. The side note to that is while we had the most specimens submitted, thankfully we didn't rate as the top county for positive lab confirmation results. However, we still wanted to find out what was going on. So as a health educator, the questions that I asked were, do we need to revise either our educational content itself, and why wasn't this information resonating amongst our target population? And we also wanted to explore whether we were delivering the message correctly, using the correct platforms and places and ways that they wanted to get information, and were we indeed hitting our target audience? So we thought that using a focus group would be an ideal way to solicit feedback from our target population. And that included both our community residents and the community providers that were working with this specific population. So next slide, please. So the focus group planning efforts, and I was very happy that we had at the time an intern, a health education intern from New Jersey City University. And she was also very instrumental on all of this, and in fact was an integral part of not only the development of the discussion guide, but also the implementation of the focus group. Here at Hudson Regional, before we go out into any community and do anything, we do like to have a conversation with our health officers and ask them, to tell them what our thinking is, what our concerns were. And we did request their approval and the opportunity to recruit participants from within their towns, as well as run the focus groups there. We also, because I know that Suzanne is the focus group guru, requested assistance from Suzanne, as well as from Krista as the point of contact for Zika virus and other tick-borne and mosquito-borne diseases. So again, we're very appreciative that we were able to have this collaborative planning effort. So all together, the group of us put together the discussion guide. Suzanne reviewed it to make sure that we were framing our questions correctly and that we were, soliciting the correct information based upon our experience. And Suzanne was also able to work with the Family Services and STD program and get some condoms for our goodie bags, and I will talk about the goodie bags later. We also, as part of our planning efforts, we wanted to identify the stakeholder organizations with whom we were going to collaborate. As you heard earlier with Suzanne, you need to work with different groups to find out how you're going to recruit your participants. Of course, we needed to determine our dates and our locations, and Suzanne did speak about that. I will share a little bit about that in a later slide, and the times. And one of the things that you'll hear about is the fact that these are really busy folks, the target population. Sometimes they don't only hold one job, they hold multiple jobs. So the timing of when we did the focus groups was also important. We wanted to make sure that we weren't only holding them during the daytime hours, that we hosted some in the evening as well, and indeed we did. So then we mounted a participant recruitment campaign, and because as a public health agency we didn't have a lot of money to do this, we used our good friend Twitter to post flyers and contact information for how people could participate. We also worked with our health officers, and they reached out to some of their residents who had submitted specimens for testing. So we actually had some folks who, this was very close to. And then we worked with the family success centers, the family assistance centers that were stood up after Superstorm Sandy. And we went directly to them and asked them if they could assist us in identifying some participants that would have an interest in this and had a vested interest. We went out to some of our stakeholders, including our federally qualified health centers that were working with these populations, and we asked them, between the three of us, could we put together these goodie bags as an incentive and a thank you to our participants. And we also, we had funding available to provide a light meal or some refreshments. We did some mornings, some lunchtime, and some evenings. So, our refreshments were based upon the time of the day. And you would be surprised with the goodie bags. They had silly things like sticky pads and pens and buttons and things like that. And no matter how crazy the contents were, people love a sticky pad or a new pen. When we went out to the dollar store, that was a really good resource to fill up the bags inexpensively. Okay, so moving on to the focus group facts. We did 2 groups in Kearney, which is on the western end of our county, and that was a very specific identification, because we have heard often that West Hudson area feels that they are not part of the county. So it was a very directed effort to include those folks. We also did a group in North Bergen, which is considered in the northern part of the county, in other words, north of Route 3. So the county is informally broken down to West Hudson, the northern region, and then the east end and south region. So we tried to do one in each of those regional areas. So 2 groups in Kearney, 1 group in North Bergen, and then we also met with the providers from our Jersey City Division of Health and Human Services, and that included health educators and the FCD clinic personnel. So we tried to geographically hit all of the areas. We did attempt to work with the Hoboken Family Planning Clinic. However, we just couldn't pull together. We couldn't sync up on the calendar, unfortunately. And we thought that that would have been a target-rich area because it was the family planning clinic. We did do some work with a presentation with the Hoboken University Medical Center Moms Group, and we had hoped to recruit from that group and fill in with clients from the family planning clinic. The participants were females of childbearing age. Some were pregnant, some had already delivered, and it did include women with various ethnicities and backgrounds, and that included Arabic, Hispanic, Latina, non-Hispanic, African American, and American. So that is a fairly decent representation of our top backgrounds here in Hudson County. We have 64 different dialects, so we had to stick to our top 5. None of our groups had any more than 10 people, and all of them had at least one facilitator and one scribe, and at times there were more than that. And we did tape the discussion using an app on our iPhone. Next slide, please. Thank you. So the discussion guide consisted of 10 questions that highlighted the following topics. We wanted to know, and we started out with a very broad question about what were their Zika concerns. We were trying to identify if they had any information about the ways that it could be transmitted. We wanted to find out about their knowledge regarding the prevention of Zika transmission and, you know, the relationship between Zika and pregnancy itself. We also wanted to know if they had a sense of what their family and their friends knew about it and what was their level of concern. We had good, rich discussions about the level of concern and also about the ways that they could prevent sexual transmission. We also wanted to talk to them about their Zika and their traveling plans because, of course, the focus in the very beginning was just avoid going to the areas that were affected with Zika. And I will share some information about that that was a little bit startling, but very, very important to us. We wanted to inquire about where and whether they knew to go for resources for information about Zika, as well as their preferred method to get that information. And we obviously, the discussion guide will be provided at the end of this session if people are interested in accessing that. So next slide, please. So the focus group findings, and I've kind of grouped them into these various categories. When you look at their knowledge base, they did have a pretty reasonable foundation of knowledge on the basics. They were somewhat aware, not as aware as we would have hoped, but somewhat aware of the linkage with sexual transmission. And they were very vocal about the fact that they use the internet to access their information. One thing that they did offer up is that when you look at the internet, there's various resources available, and they offered up that the only ones that they saw as credible is whether it came from a health department website or the domain ended in .gov, .edu, or something credible. If it was a .com or a .net, they didn't necessarily believe that that could be credible. We also got some good information about their attitude, and one of the things that we got that maybe wasn't what we wanted to hear but was very useful was that it was in the background. They knew that it was there, but they were going to worry about it when it was a problem here in the continental United States. So they were kind of keeping tabs on it, but they were really going to pay attention to it if and when it came to the continental United States, and specifically New Jersey and Hudson County. Under attitude, they shared with us that although they were well aware that certain countries had local transmission, it wasn't going to change their travel plans at all. And so that became very important when we started thinking about how we were going to frame our messaging and direct our messaging. They were very clear in the fact that if they had a vacation plan to go visit family members in some of these countries that are their family homes, they weren't changing those plans because of this thing called Zika. And they also shared with us, and this is probably one of the richest things we got from the focus groups, they shared with us that the recommendations weren't always realistic for their family situation. For instance, they told us that in the summertime, it's customary for them to send their children home to be with family, cousins or grandparents or whomever, because mom and dad still needed to work and they simply couldn't afford a camp or a child care center. So their solution was to send the children home for the summer. So again, to simply send out the message to avoid traveling to these countries with local transmission, that simply wasn't realistic for them. So we needed to rethink the types of messages that we were giving to them, and we'll talk about that. The prevention, they clearly understood that mosquito bites were the primary source of infection, but they weren't as clear about the linkage between getting the mosquito bite, potentially being asymptomatic, not showing any symptoms at all, and then becoming infected and sexually transmitting it by having unprotected sex. So that came out as a clear front runner on a priority for expanding the education about Zika and how people could get it. They were very aware of the dump and drain campaigns because they had been hearing it since the introduction of West Nile virus, basically since 2000. So that information was something that they were pretty comfortable with, and their knowledge level was very high. Okay, when we shifted over to questions about pregnancy, we found out that it wasn't very clear at all that men needed to use a condom throughout the duration of pregnancy, because their association with condom use was twofold, really. It was if you're already pregnant, obviously you're not trying to prevent a pregnancy, so why use a condom? And we'll talk a little bit more at the bottom about monogamous relationships, but when you're in a trust relationship, you don't necessarily use a condom. So if they were desiring a pregnancy, and many of them were clear about this, they were willing to take the chance. They wanted to get pregnant, so they couldn't use protection, but they were willing to take the chance of potentially getting infected with Zika. Many of them shared with us that their partner would be traveling back and forth from continental US to their home country, and that, quite frankly, they had a very small window of opportunity, if you will, if they wanted to expand their family. And they weren't about to lose that opportunity and have to wait another year or however long it would take for Zika to come under control. So they were willing to take the chance. There was a large cultural influence in terms of their likelihood to follow the recommendations or not. We learned pretty clearly that the men were not as knowledgeable. The women in the group shared that they knew about it, they read about it, but the men didn't have the same level of knowledge about the way Zika was transmitted as well as the way it was prevented. In many cultures, men make the final decision with regards to condom use. And it kind of stems from the machismo in some of these cultures. And the women were pretty forthcoming with the fact that it wasn't going to be a discussion. If the men said, I'm not using a condom, they didn't use a condom. There was also this notion of trust and unprotected sex. And in many cultures, a monogamous relationship equated to unprotected sex and trust. So you only use a condom if you want to prevent pregnancy, or you're in a brand new relationship where you're still building that trust. And even more important, suggesting the use of condoms was viewed as insulting, and it was an attack on their fidelity. So that was not something that was expected, yet it was very, very important to how we were going to continue our messaging and our education amongst this population. So those were the findings, the relevant and highlighted findings of the focus groups. There's my contact information, and what you're going to hear next will be Krista Real from the State Department of Health, and she'll talk about what we were going to do with these findings and our action steps. So thank you.
Great, thank you so much, Monique. And I'm going to recommend again, if you have any questions for Monique, if you can go ahead and put those in the chat feature. That will be helpful to us. And just bear with me for 1 second while I get Krista up and rolling. I apologize, I was muted yet again talking to all of you. Krista, can you see your slides there? I'm sorry, I was having a little technical difficulty.
I can, thank you.
Okay, so just a brief bio on Krista. She currently works for the New Jersey Department of Health and the Communicable Disease Service. She's primarily responsible for the Vector-Borne Disease Health Education Initiative. Prior to joining the DOH, she worked as a health educator in hospitals, focusing on school health improvement and healthcare employee wellness. Krista holds her Master's of the Arts degree in Health Promotion Management from Rowan University. She is a certified health education specialist and has been implementing, overseeing, and evaluating health education and disease prevention activities since 2008. So I'll give it to you, Krista, to take it away.
Sure, thank you very much, Linda. So I'm just going to wrap up this presentation talking about the steps following a focus group. So that includes communicating your message and also targeting your audience. So I'm going to explain the action items that resulted from the focus groups that Monique just discussed, and then also how we responded to those action items. So when you want a group or an individual to make a change, the behavior change and the reasons why they're making that change really needs to have some type of personal significance. So it really has to mean something to them. And since health behaviors are ingrained in all of our relationships and the environment, changing just one health behavior can involve a major lifestyle change. And I think, yeah, can we just do one more? And then the next one, thank you. So when you're communicating your health message, your message needs to be adapted to the group or the individual, and that group or individual can be based on any kind of shared characteristics. And I have a few examples up there, but really the key in that is figuring out how much customization that you really need in order to get your message across. So in order to predict how specialized the message needs to be to encourage that desired behavior change, you need to first recognize the needs and the current situation of the audience that you're trying to reach. And again, that's exactly what the focus groups that Monique discussed allowed us to do in this situation. Thank you. So with health message targeting, you are narrowing down your intended audience by distinguishing a group based on shared characteristics. And again, I'm just going to throw up some really common examples of how you can group those people together. So health message targeting takes those characteristics into consideration and delivers information in a corresponding approach. So you're really matching your audience to the information. However, it's important to understand and also expect that there's going to be at least some inconsistency within your targeted population. So with the action items that we learned, on the next slide, please. So with the action items that we learned in the focus groups at Hudson, first was really creating a message developed specifically for men and condom use, as Monique described. The men were not as knowledgeable and they weren't so sure about the proper use of condoms. So we knew that that was going to be the #1 focus. And again, because as Monique mentioned, the men in the relationships were the ones who were doing the birth control planning and pregnancy planning, and they were making those decisions. So we knew that we really wanted to focus on the men and develop something specific to them. We also wanted to deliver information through schools and specifically through sports teams. The participants told us that coaches and other male sports staff were looked at as trusted leaders for men. So that could be a good way that we can spread Zika information through the schools and through the sports teams. The third was to improve healthcare provider engagement and education. We knew it was going to be really important for clinicians to be aware of Zika and also understand the guidelines and the prevention recommendations so they could and then impart that knowledge onto their patients. Fourth was to communicate travel recommendations and preventive messaging to everyone. As Monique had mentioned, it was very clear that families were going to travel and some of them had no choice. So simply telling a pregnant woman to not travel was not going to work. So we really had to rethink about the messaging and figure out that we need to do preventive messaging just for everybody in case they're going to travel. And lastly, we definitely wanted to acknowledge myths and rumors. There were a lot of things that we kept hearing about, and so we wanted to not only address the things that we were hearing, the myths and the rumors, but we also wanted to correct that misinformation. So what did we do with these action items? So the first thing we did is we created a flyer specifically for men. And it was really geared towards the recommendations to first avoid mosquito bites and second to use condoms when traveling to an area with Zika. And so what we did with those flyers is we did 2 different pre-testing sessions. We did one with 6 men at the Hudson Regional Health Commission, and then we had 5 men look at this flyer at the Camden County Department of Health and Human Services. And really the reasoning behind the pre-testing was we wanted to, similar to focus groups, get an idea of what men thought about this flyer. Is it going to do what we want it to do? Is it going to get the message across? And really just kind of understand what the men actually thought about this. So interestingly, there were a lot of suggestions for improvements, and I think one of the most interesting things was the men did not want any information to be sugar-coated. They didn't want to see a happy family on the flyer with a very healthy-looking baby. They really wanted to see something a little more shocking, and they wanted to see a realistic description and depiction of Zika virus and the effects. So we thought that was pretty interesting. And then with the information through schools, what we did with that is Monique actually presented at the Hudson County Superintendent's Roundtable meeting and made a request to post Zika information online. And so far, one district actually does have Zika information online, and we're working to get other districts that information so that they can post that online as well. And so while posting information online is a great way for most people to get information, we did recognize that not everyone has access to the internet or doesn't have computers. So we also discussed printing out information in multiple languages and having that information available in the school. So either in the main office or in the nurse's office. And that way, people who did not have a computer and didn't have access to the internet would still be able to have access to the Zika information. And if we do move forward with that, we are going to have assistance from the Medical Reserve Corps. And then lastly, the third kind of action item that we worked on was the addressing common myths and rumors. So again, acknowledgement of and the correction of myths and rumors based on what we heard from the feedback from the participants, we incorporated that into our outreach efforts. So for example, at health fairs or things that we put online, and we also updated our Department of Health Zika Basics webinar toolkit, which was a slide set that was developed for local public health educators to go out into their communities and deliver information about Zika. So we actually added some information to that training toolkit and really focused on what were some of the things that we were hearing and some of the myths and rumors and being able to correct that information and address it. And lastly, we really wanted to focus on our core message of preventing mosquito bites and not get lost in the sexual prevention of Zika and focusing on Zika on its own. We also have a lot of different mosquito-borne diseases in New Jersey. We have West Nile virus and St. Louis encephalitis. So we didn't want to forget about those different diseases. And so while we definitely incorporated Zika education, because it's a little bit different with the sexual transmission, into our mosquito-borne disease prevention information, we definitely wanted to keep that core information of preventing mosquito bites and preventing mosquito breeding in the forefront of everyone's minds. So last but not least, with some long-term planning, we would love to develop a multi-layered media campaign and really be able to reach the most amount of people with Zika information. We've also discussed partnering with New Jersey Department of Education to integrate Zika information into the middle and the high school curriculum. And we're also continuing to explore innovative methods to disseminate the educational information. So just some ideas that have been tossed out include company mass email, putting information into a paycheck stuffer, going to the cash checking companies and putting information there so people who get their checks cashed can access that information, and also possibly putting a posting on the jitney buses around. So we just have some different ideas about the long-term ideas with Zika. So with that, I will end, and I think my contact information is up there. If anyone has any questions or needs to contact me for any reason, I'd be happy to talk to anyone. And do we have time for questions? Not sure.
I think, thank you, Krista, very much. I have a comment on the chat. Can anybody hear me? Because it sounds like people cannot hear Krista. Okay, the sound sounds like it's back. So I apologize if there was any issues with the sound at the end of Krista's contact there, but I know that we are technically out of time, but I do want to open it up if there are any questions. Feel free to unmute your line if you would like to ask it personally, or you can write it into the chat box here.
45.
I actually had one for you, Suzanne, maybe while we wait to see if anybody has another question. You had mentioned the focus group facilities. I actually did not realize that those exist. Where did you guys use that? Is that local to you?
No, it was up in Bergen County. I found, we have to go through the whole process of getting, different vendor quotes, but there are many organizations that do this, and there are facilities throughout the state.
Was the cost pretty substantial to use their facilities?
It was, I'm thinking about 6,000 or 7,000, maybe 8.
Okay, and that was for the multiple sessions, I'm assuming?
And we did one. That was one. They recruited one session for us, and they did all of the audio recording and the typed transcripts, verbatim transcripts.
Gotcha, okay. I have a couple questions coming up here. So Monique, it looks like there's one for you here. You had mentioned American in your previous slide. Is that Native American or is that white American? It wasn't clear.
That is white American. Can everyone hear me? Yeah,
Yep.
that was white American.
Okay.
So that question was answered. I thought I saw another one on here that I might be able to. Oh, the focus group meetings were between an hour and an hour and a half. We didn't go longer than an hour and a half.
And Suzanne, is
Hi,
that
Angela.
typical with
Thanks for the question.
Is that typical for you as well, about an hour to an hour and a half for your focus group experience?
Yes.
Okay. Okay, so I have another one here. What did the pre-test flyer session look like? Similar to the focus groups? I'm thinking maybe that was for you, Krista, with pre-testing the mail information flyer.
Sure, or actually Monique can probably answer that too with the one at Hudson.
So we recruited from within our employees here, and we did have 6 male employees agree to participate. It was also about an hour at length. We did it at lunchtime and provided pizza to them because, if you have food, they will come. And we just had all of the materials laid out, and I had pretty much a discussion guide ready. Tell me what you like about the flyer. Is there anything that isn't clear? Krista and I had worked together on developing those questions. And as she mentioned, they were very vocal and forthcoming with their comments and questions. And probably the biggest theme was that they didn't want anything sugar-coated. they quickly picked out that the family looked too happy for a family who could potentially be affected with a Zika infection and a baby with microcephaly. And they explicitly said, put a family on there that doesn't look happy and include a picture of a baby with microcephaly, that this happy family just wasn't cutting it. They also give us some suggestions about the placement and the formatting on the flyer, what should be bolded, maybe a different color. But the overall theme was hit it hard and don't sugarcoat the information.
Great, thank you, Monique. I have just one comment on here. I think maybe Krista and Suzanne, you're looking as well, but comment for you, Krista, a suggestion to post flyers in a barbershop, perhaps to gain a better reach there.
Yeah, great suggestion.
And it looks like Candace has posted a link to a Time article that might be of interest to everybody, so I'll make sure that that gets sent out with the rest of the post event information. And it looks like we have one more question. So how can you adjust this evaluation of a pilot education program?
I'm not exactly sure what that means.
How can you adjust this for evaluation of a pilot education program?
Anna, are you referring to perhaps a just kind of a more generalized topic? I'm not sure we understand exactly what you're asking. Okay, so for a workshop, she's saying specifically.
To conduct a focus group to evaluate a workshop? Is that correct?
Evaluation of an educational workshop. So could you perhaps use a focus group to do that?
You could, especially if that workshop was like a pilot test before being rolled out at a larger scale. You could definitely do a focus group among people who participated in that workshop to find out more about their reactions, about the methods and topics and whatnot. I think that's reasonable.
Great. All right, well, I'm gonna actually, it does not look like we have any more questions coming through the chat, so I think I'm gonna end us here. So thank you everybody for joining us, and thank you Suzanne, thank you Monique, and thank you Krista for your time and your expertise. I apologize if my initial thank you to you, Monique, was muted while I was talking to no one. So I just wanted to give just a quick reminder before you jump off, if you're still with us. The slides will be sent out along with the evaluation. Monique also mentioned that the discussion guide will be going out as another example to you. So please make sure that you are filling out the evaluation form. And if you are claiming credits, please make sure that you include your CHES or MCHES number there. And come see us for our mid-year program. We're going to be hosting it on June 7th at Rutgers University on College Ave's campus. So more information will be coming through our listserv soon on that. And again, thank you everybody for all of your time today.